Welcome to the HealthspanMD podcast. So welcome to the HealthsPan podcast, where we talk about the science of longevity. This podcast is for those of us who are not willing to leave healthy years on the table. And we talk about achieving the three essentials of longevity: a strong body, a healthy brain, and medicine 3.0. That's healthcare that goes beyond just taking care of you when you're sick and actively looks for the opportunities to avoid disease and stay healthy. And our guest today is going to touch on all three of those essentials. It's truly my honor to have Dr. Karla on as our expert guest today. Welcome, Dr. Karla.
Hi, Todd. Thank you so much for having me.
Oh, it really is an honor. So a little background, I've known Dr. Karla for some time through a really good friend of mine who's a cardiologist, her husband, who I have great respect for. And, along the way, learning more about Dr. Karla, how she takes care of patients and her background, I'm like, she has to be on a podcast that's about longevity. And so, you have this great backstory. You're currently an expert in acupuncture, and that's what your practice is. But you started as a traditionally trained MD. You went to medical school. You have a medical degree. And I know the tool that you use in your practice primarily is acupuncture. So I'm just curious, how does acupuncture work from a scientific, but also taking in that kind of Eastern medicine perspective? Tell us more about that.
Okay, so I'm going to start first how acupuncture works according to traditional Chinese medicine. And so acupuncture, first, traditional Chinese medicine is a medicine that has existed for over 3,000 of years. And according to traditional Chinese medicine, we have channels called meridians that run along the body. And those channels are connected between each other, and they're also connected to internal organs. So we have the channel of the lung, the large intestine, the spleen, the stomach, etc. So those channels are full of energy. That's called qi in Chinese medicine. And when the qi is balanced and it runs smoothly in the body, we have health. So when any of those channels can get blocked, and they can get blocked by injury, trauma, surgeries, infections, stuck emotions, you name it, then the energy is not flowing properly in the body, and that's how disease arises. So what acupuncture does is by inserting very fine needles over specific points over those channels, reestablishes the flow of qi, and the body heals by itself. So we're just only awakening our own healing capabilities.
Oh, that's fascinating. And so do you have like a standard pattern of needles depending on the problem that the patient presents with?
Yeah, so I usually use very, very thin needles. Compared to dry needling therapies that use much thicker. Acupuncture is usually use thinner needles. Of course, when we use needles on the face, yes, needles are definitely thinner. And of course, I use the best quality of needles. They are a little bit longer when we needle thicker muscles, but usually it's a pretty standard measurement.
And is the location, is that determined by the problem the patient has? Is
exactly.
That right?
Yes,
okay.
Exactly. So the diagnosis in Chinese medicine is very different. So somebody that has the same symptoms the symptoms can arise from different problems. So you don't treat every person the same way as you treat another. So depending on symptoms, depending on certain patterns, you decide which points you use.
Yeah. So, acupuncture, you probably had this experience, I don't know, but in my medical training, acupuncture, at least in the early days, was kind of looked at with disdain from a traditional medicine, like, oh, that's just, hocus pocus or whatever. But, the reality is the data just, piled up to the point where even the Mayo Clinic had people on staff who did acupuncture. In fact, one of them is a cardiologist, interestingly. But and actually, I had acupuncture. I had a chronic tendonitis of my patella tendon, and nothing was really working for it. All the different therapies, physical therapy, and things. And so I tried acupuncture. Tell me about the people that they come to you and you say they're looking for help and they have a problem, and you say, yep, that's the person. Like, who are those people that really benefit from your practice?
So sorry to change the subject just a tiny bit, but I just want to tell you that I was one of those persons that was very skeptical about acupuncture. So as you know, I went to medical school in Mexico. And when I was in medical school, my grandparents used to go to acupuncture. And I was very Western-minded as a student in medical school more than 20 years ago. So I was really impressed how my grandparents were feeling so amazingly after acupuncture. But even though I was still very skeptic, sometimes I thought, well, maybe it's placebo, maybe, I was not very into it. So later, as I put my medical career in pause because I had 2 kids and I decided to raise them. And when I was maybe about more than 10 years ago, I injured my knee. And as a mom, I was more into like holistic approaches. Of course, if they had an infection and they needed antibiotic, of course, my kids got antibiotics. But I was always thinking about more natural approaches for care. So when I injured my knee and they gave me so many medications and they was destroying my stomach, I thought, well, maybe I should try acupuncture. My grandparents saw so much relief from it. So I had acupuncture for my knee and I had 3 treatments and the pain went away. And I was really shocked. So when I was ready to start my medical training again, my kids were in preschool, I thought, maybe I should do acupuncture. I like it. I think it gets great results. It's compatible to the way of life that I want to have, be home with my kids more. So that's how I started with acupuncture, also with a knee injury and amazing results.
That's fascinating. Yes. Like, what a great backstory for that. And you're right. Like, chronic pain is one of the things that traditional medicine has really, fumbled. We're not good at it. You just look at the opioid epidemic, and if there's not a better example of why we don't do a good job in traditional medicine, or how this reactive, here's a medication approach isn't the answer. It's with chronic pain. You came to this with pain that wasn't being addressed, and with traditional medicine, or not, at least without side effects, and said, "Oh wow, I really feel a lot better," and then that led to you. So now, are those the people that are best fits for your practice? Is it a chronic pain thing, or are there other aspects of symptoms that people come to you with?
So I'm going to say acupuncture helps a wide array of conditions. Chronic pain is definitely the ones that I see the most. Acupuncture is very well known for helping pain. So when I see patients, I can say that most of them have chronic pain. And I see good results. It's not for everybody. It's not for everything. Sometimes it works amazingly. There are certain cases when it doesn't. It's very hard to know at the beginning sometimes if it's going to work. But I usually ask my patients to come with a diagnosis. Sometimes they don't. I think younger people tend to maybe try acupuncture first before getting more treatments. So chronic pain is definitely something that I see a lot, and acute pain as well. But not only that, acupuncture is really great for stress-related problems, for insomnia, for anxiety. It really works amazingly for nausea and vomiting for post-chemotherapy. So I do see patients that come for that, and it really improves their quality of life because they really feel awful after having the treatment, and it helps them feel a little bit better and regain some strength. I see also patients for hormonal balance and peri and postmenopause, and digestive issues as well. So there's really a big array of conditions that acupuncture can help with. The World Health Organization came up with a list of conditions that acupuncture can help with, and they divide acupuncture, the conditions that acupuncture can treat in 3 categories. And the first category says that those are the conditions that are proven to be effective. For acupuncture is proven to be effective, and of course, pain management is the first one. And it's not only pain from lower back pain or neck or shoulder, but pain post-surgery, and also pain arising from dental problems. The other things that there's proof that acupuncture helps with is osteoarthritis, especially knee osteoarthritis, allergic rhinitis, and hypertension, and sciatic pain, which is part of the chronic pain management. So I will say what I see the most is definitely pain.
Yeah. I mean, you solving acute problems. What do people have that they're not getting answers for? That makes a lot of sense. I think it's probably really impactful in your practice, this experience that you have in traditional medicine, but then also this Eastern medicine. I don't like the word alternative medicine, but let's just say outside of the traditional medicine track. So I'm going to take advantage of this and get a free consult for myself. So I have an inflammatory arthritis problem that I can treat with anti-inflammatory medicines, but they're just a symptom relief. They're not treating the underlying pathology. If somebody came to you, and I know this is vague, but just in generalization, you have that understanding of traditional medicine as, are we treating the underlying condition, or are we just treating the symptoms of this? Where would you put acupuncture in that? Is it doing one, the other, or is it a both thing?
So it's both things. So in traditional Chinese medicine, there is focus on the root of the problem. So that's the main thing. But of course, they talk also about the branches, which are the symptoms. So you cannot see a patient without treating the symptoms, because that's why they come to see you, right? They're dealing with pain. And if you say, I'm going to treat the root of the problem, we'll take care of the pain later, nobody's going to try acupuncture again. Right. So I do both at the same time. So now that you're mentioning arthritis, and this is, of course, osteoarthritis, right? It's not an autoimmune.
It's an inflammatory arthritis.
Okay, so I do have a patient that has, I have many, but now that comes to my mind that it's active right now. She has been dealing with rheumatoid arthritis for 30 years. And she is on disease-modifying anti-rheumatic drugs, and she's pretty well controlled. She has a very healthy lifestyle. She's a lawyer. She's very... she has a very stressful life, but even though she's really focused on having a very healthy diet and exercise and sleep, and I think she does a pretty good job, but she's still having a lot of pain on her wrists. So she doesn't come as often as she would because she's extremely busy, but she comes because she does find a lot of relief, and she doesn't need to rely on so many medications for pain because of acupuncture. So acupuncture really helps her, but at the same time, I'm treating the root of the problem.
Yeah, I think your insights are brilliant. I learned this from a physical therapist that we work closely with and has been a guest on our podcast, Matt Gloyd. But when I went to meet him just to understand what he does in his practice, because I'd heard wonderful things about him, he starts using his little vibration devices on me while we're talking, and I felt great. And I ended up being his patient, as a matter of fact, even though I didn't go to him with a problem. But, he brings that point up all the time. He's like, if you can give the patient a win early on, like show them some benefit right off the bat,
absolutely,
then they're bought in. He says, then I can really help them.
Yes.
But you're exactly right. And that's one of the challenges that we have in cardiology is a lot of the things we do, like treating high blood pressure, like treating high cholesterol, those don't make people feel bad, right? Until they do, until the heart attack occurs or the stroke or whatever. And it is a challenge for patients to say, well, I don't want to take this medicine, especially if I don't feel the best on it, when I didn't feel bad in the beginning. It's one of the things that we really struggle with. So, I want to go back to this chronic pain issue, just because it's so prevalent. Like I hear about this, even though I'm a cardiologist, I hear about this a lot in my practice because we emphasize the magic of physical activity in helping people with longevity. Like, I don't know if there's a better intervention that we have than being active, but there's a lot of people that say, I'd love to do that, or I used to do that, but now I have back pain, knee pain, hip pain, whatever that is, and I cannot do it. And a lot of times I'm not sure, how to help them. They've been to physical therapy, they got their 5 sessions and Medicare said no more, right? The surgeon says, well, we could operate. or we could not. But okay, we're going to go to the pain medicine doctor, and that can open a can of worms. I mean, I think
Yes.
it's moving beyond just being an opioid, practice. But tell me, for those people out there now that have a chronic pain issue that they're just not finding answers for, talk a little bit about what you do in the assessment, and then the people that you're going to say, yep, I'm going to help this person. I feel really good about what I'm going to do for them.
Okay, so it's very important to know that acupuncture is just one of the branches of traditional Chinese medicine. So it's just one of the tools that we have to help people feel better. So when I see a patient, I don't see only chronic back pain, of course. I see a whole person.
Right.
And I address the mind, the body, and the spirit at the same time, which is very important because, as you know, Todd, chronic pain does put a big toll on or how we feel. Chronic pain does bring a lot of stress, depression, anxiety.
Amen.
And, acupuncture helps people not only with pain, but helps them relax. I have a patient that is in a lot of pain, and, acupuncture has been really able to help her feel a little bit better, but she's still struggling with pain. But every time she comes and sits up after the treatment, she says, I feel so much better.
Yeah.
So much better. And that is because I'm just not addressing the pain. I'm addressing also the emotional part. And that's really huge because people need that too. Feel calm, feel relaxed. When you feel calm and relaxed, the brain perception of pain reduces as well. So did that answer your question?
Absolutely. Well, it's just very aligned with what I've learned as in 30 years now of being a physician, is that, I started out with our traditional training is very reactive, right? When people have problems, they come to us and we try to solve them, or we look for disease, and if we find it, here's a medication to treat that. But what I was frustrated with is that a lot of people weren't getting healthier. They weren't. I was doing all of the right things that I knew of, but what was I missing in this? And I realized that, there's another aspect of the medical care. That's the, looking for those opportunities to help keep people healthy. In cardiology, that's going to be, nutrition, physical activity, sleep, stress, avoiding toxins. Those are the things that we talk a lot about. But, as my practice has evolved to more of a longevity practice, I realize even, medicine 3.0, that, proactive, holistic approach isn't enough if you don't have the strong body and a healthy brain. And part of a healthy brain is being pain-free. Like,
yes.
You can't have a healthy brain if you're depressed, if you're anxious, if you're socially disconnected, if you're, low resilience, like all those things. So what you're talking about, and I know, just from personal experience, going through times when I've had pain, I've had some back issues that have laid me up for a week. That's a miserable week. Like all of a sudden the things that didn't bother me really bother me. All of a sudden, all the worries that, I kind of check off and dismiss, they started piling up, and I felt terrible because my back hurt and I couldn't be active to do that. And so I can totally understand what you're saying is give them some relief right off. Like, give them some of that pain relief. That's just going to set what we talk a lot about, that virtuous cycle. People get in a vicious cycle where they get injured, then they stop being active, which then that affects their sleep, but then they, it keeps spiraling down. We need to get in that virtuous cycle. And it sounds like you're addressing that virtuous cycle at multiple points for those patients.
Yes, exactly. So it's not a Band-Aid medicine. I'm not only addressing the symptoms. I'm trying to go a little bit deeper and know what's the root of the problem and help them feel better, not only physically, but emotionally. And like you said, so what they eat, because as we know, food is medicine. How much are they moving? How are they sleeping? Everything that's surrounding them, it's important to make somebody feel better.
Yeah. So tell me, what's the usual process? Somebody's interested in your practice, how you do things. what would they expect? So they're going to call, they're going to say, oh, got an appointment with Dr. Karla, at 1:00 tomorrow. What's going to happen to them? Like, walk me through that.
So I usually offer free consultations, which I think are very important because people can come in, can talk with me, and I usually can see a little bit how acupuncture can help them, and I can explain how is that going to work. And they can decide if they're ready to jump into something like this. Why? Because acupuncture is not a one-time thing. So unfortunately, we live in a world where we want immediate results. So they want to come into one acupuncture treatment and feel completely healed and then don't come back again. So that's not really how it is.
Yeah.
Acupuncture works and works amazingly. It's really hard to say how many treatments somebody's going to need. Of course, there's research and sometimes you see that, 10 treatments. It's just really hard. Every person responds so differently. And it depends on the age of the person, their overall health, medications they're taking, so many things involved to that. So I usually explain that to them. And if they're ready to jump into something like that, then we schedule an appointment. So once they come in, I do a full medical history. So I do mix a little bit of the Chinese medicine medical history with the regular one because of my background. And I also had a training in functional medicine, so I integrate everything. So once I talk about them about what's going on and their past medical history and other symptoms and how their body is working in general, I do a medical exam. And in Chinese medicine, we check the tongue and the pulses. So I know it kind of sounds weird, but it gives an overall understanding what's going on in the body. So in the tongue, we see the color, the shape, if it's hydrated or if it's moist or if it's dry, if it has like scallops or tooth marks around, and that helps give a Chinese medical diagnosis. And then the pulses. There's 3 pulses on each wrist, on the radial artery, and you can diagnose overall how organs are working. That's a tough one. You need a lot of training and years and years of experience, but you can still detect some of imbalances in the body. And then after that, people usually lay down, depending on what the treatment is going to be. If they have back pain, sometimes they lay down supine, so I can treat their back. Sometimes, so it depends, because acupuncture, sometimes you can do acupuncture locally in the area of pain, and sometimes you can treat distally, and that works as well. So there's many ways acupuncture work. And then they lay down with the needles for about 20, 30 minutes, depending on what's going on. And then I remove the needles. And usually they do feel a deep state of relaxation. Acupuncture stimulates the release of endorphins, which, as we know, they're our own natural painkillers. That's why acupuncture is so amazing for pain. But it's the good feel hormone. So usually people after acupuncture do feel relaxed. Sometimes pain can improve significantly. Sometimes it takes more treatments to find relief, but I will say that most of the time there's some relief after acupuncture. And very, very, very small amount of cases, there can be kind of like a healing crisis. So people feel a little bit worse before they start feeling better. I always tell my patients that can happen, just so they are not surprised. It doesn't happen very often, but it's something that can happen.
Yeah. I mean, I think that goes along with what I tell my patients is I don't think about any treatment, medicine or whatever as being a forever thing necessarily. You're always assessing, is this something I need to continue with, or is this something that I don't? And my guess is somebody comes to see you for a problem. You treat them. If it helps, but it's not resolved, well, then they need to come back, right?
Yes,
and
exactly.
But you're not locking them into here's our 18-month
we're gonna be here forever.
No. So
No.
that makes a total sense to me. I get patients who now that in cardiology we have pretty amazing tools that are injectable medicines. And I get a number of people who are like, what? Needle? Well, you didn't tell me anything about a needle. How, or do those people come to you, or they just stay away completely? Like, oh, I don't want anything to do with needles.
So I've had those people too. Yeah. Yes. So of course, when you hear needle, it's really scary and frightening. Acupuncture needles are really so thin. Some of them can even fit inside. I've blocked out on the name. Just a regular injectable needle. That's how thin they are. Sometimes you don't even feel them when they go in. Sometimes you do feel like a tiny prick, but because the needles are, they're solid and there's no that hollow inside of them, it's not the same as having a shot. So it's really not a painful situation. Now, dry needling, which I do as well, I have training in dry needling, can be a little bit more painful. So dry needling usually uses trigger points or motor points, and sometimes you stimulate the trigger point, and it can be a little bit more achy, but it's really not a painful situation.
Yeah. So I'm thinking about movies I've seen where acupuncture, and it's kind of a joke thing where somebody has like 100 needles stuck in them. You know?
Yes.
What's the typical? Like I know there's variations in that.
Yes, definitely variations. So I do get patients that say, "Oh, I'm coming for back pain, but I also have neck pain, shoulder pain, wrist pain," and I'm like, "Okay."
I think those are my patients. Yes,
I think I'm gonna use like 100 needles. No, I never do that. I never do that. So I usually say I use between 10 and 20 needles per treatment.
Okay.
That's the average. Yes.
Okay. Beautiful. So, we talked about brain health and the importance of, treating pain and that, and, you take that holistic approach to health. And in longevity, we think a lot about that healthy brain, one, in its quality of life, its impact now, but also, a lot of people are rightfully very concerned about losing cognitive function as the years go by. And I clearly, can't do math in my head now that I could do when I was 20 years of age. Is that something that you, in your practice, you have any, experience with or insights in that you would share with the audience?
Yes, absolutely. So I really don't get people into the door saying, help me, I'm having cognitive decline.
Sure. Yeah.
It's not something that happens very often. There are studies that have shown that acupuncture does help with mild cognitive decline. So functional MRIs have seen that there's activation of certain areas of the brain when you stimulate some acupuncture needles. So acupuncture can really increase brain activity and brain blood flow. So there's some benefit. I definitely, so when somebody tells me, I'm having a little bit of brain fog, or it's really getting hard for me to remember some words or things like that. Of course, if it's something that I need to be addressed by a medical doctor, I always refer, but I use some acupuncture points that help them have a more clear mind, and it does help. It definitely helps.
Okay. How much time do you spend, if any, on the medical evaluation that's been done by other doctors? Like, do you look at the lab test? Do you look at the MRI?
Yes.
Do you use any of that?
I usually don't look at x-rays or anything like that.
Right.
I see the reports, and I always see lab tests if they bring them, definitely. On them. So yes, absolutely. I do check lab tests, and I do see the reports of X-rays and MRIs, and that helps me. That definitely helps me how to address and decide what am I gonna do.
So I would guess that you get a lot of patients who traditional medicine just isn't doing a very good job with. Of course, if it's something that we're good at, you're not going to get somebody who's, hey, I'm having a heart attack, I think I need acupuncture, right? Mm-hmm. We're pretty good at that part. But those are challenging patients because the answers aren't easy. I mean, I guess I'm thinking along the lines like long COVID now. That's a problem that I see in my cardiology practice a lot now, that because what are the symptoms? They feel short of breath. They feel their heart is racing, their, palpitations, they're low energy, those kind of things. Is that something you've had any experience with in your practice?
Long COVID, yes, definitely. I've seen patients with long COVID feeling much, much better and regain mainly stamina, and they don't feel as fatigued as they were, and definitely improving the shortness of breath.
Okay, I'm going to give you the big challenge now.
Yes.
So, I tell patients whenever they tell me, I just have felt really tired. I'm fatigued, and I say that's the thing doctors kind of cringe when they hear, because the list of things that can cause you to feel fatigued is, feels textbooks,
unlimited,
right?
Yes.
And then it's such a common, problem as well. And it's frustrating because the patient, says, oh, I'm feeling fatigued. And we do a bunch of heart tests and say, oh, your heart looks great. And they're like, well, I'm glad, but I'm still fatigued. Like, is that something that you see as well?
I do. And I usually ask them, have you checked your heart? How's your thyroid? Have you checked your thyroid? So many things.
Right. You make sure you're not missing something medical.
Exactly.
Right.
Yes,
right.
Because, the Hippocratic Oath, do not harm. And acupuncture is really, really mild. It's not going to harm anybody unless you don't know what you're doing, right? And you're putting a needle straight into your chest and puncturing the lung.
Yeah.
But it's really mild. It's not going to harm anybody. But I just want to make sure that I'm not missing anything. And I'm not saying, yes, I'm going to help you. And they have something else that needs to be addressed.
Right.
So I always ask, and I always tell them, well, you need blood work. We need to check what's going on. And yes, acupuncture can definitely help. There are some acupuncture points in the body that really help with energy. And I use also a Chinese herb that's called moxa, mugwort, and I use it on top, usually on top of the needle. And what it does, it warms that channel, that meridian of energy, and helps blood flow. And it really helps sometimes feel a little bit more energetic after you have it.
And that goes along with when I tell people, in my practice, any intervention, whether it's a medication, nutrition, physical activity, procedure, whatever, we need to assess the risks, the benefits, and then the patient preferences. And,
yes.
And those are unique to each individual. The risks, example, penicillin, a life-changing, medicine-changing intervention that we have. Some people have allergies to penicillin, not the right choice, too much risk for them. You bring up a good point about acupuncture, and what you're saying here is, benefits. Those are things that you say, oh, I think I can help you, but we also have to take into account the risk, and the risks are exceedingly low. What are the risks of acupuncture?
Okay, so the first one is infection, of course, because every time you puncture the skin, there's risk of infection. I've never, ever seen in 10 years being out of acupuncture school an infection from an acupuncture needle.
So you don't lick the needle and then stick it in?
No,
okay.
Well, no, I don't.
Yeah. You stop doing that.
Yes,
okay.
Absolutely. Yeah. It's not part of my practice. Yeah. So, that's not the first one. Bruising is something that really happens. It doesn't happen very often. I, of course, stay away from large blood vessels. Every acupuncturist does. But we don't have microscopic eyes. So sometimes we can poke very tiny blood vessels, and there can be some bruising. It doesn't happen very often. There are people that are more prone to bruising, and it can happen, but it's not very common.
Yeah.
Sometimes a tiny drop of blood can happen. As I said, infection, but I've really never seen an infection. And there's reported cases of pneumothorax, so collapsing of the lungs because of needles going right straight to the thorax. It really has never happened with an acupuncturist, more with physical therapists that haven't had good training. I don't think it's happening that much anymore because physical therapists are not receiving better training.
Right.
But yes.
Okay. Yeah, that makes a lot of sense. Another thing that I think a lot about, and I don't know if this is something that it'll resonate with you, but when I have, my 30 years of being a physician, I see people going through a lot of changes of health and life. I've had the pleasure of having patients for 20 plus years in my practice, and them going from, older to old. And then the things that I've noticed, in a long way of going around to this question, the thing that I've noticed is that when somebody shows me that their resilience is low, that's when I get really worried about their future health. Like, examples, extreme examples, a patient, long-term patient, had a death of a spouse, and they're just not recovering from that. They're just saying, okay, this, I don't know, I don't see much reason to go on. Or they faced other challenges, health challenges, and they're giving up, and that's when I'm like, my ears go up. That resilience, is that something you ever think about in your practice, or you've ever, considered in your therapies as a potential tool? Like, is that something that you can help people with, or something that, you can impact? Do you believe that just, I don't know, drive to be alive, like drive
Yes.
to continue to take the blows of life and keep going, which we all have to do?
Yes. I will say, as I said before, acupuncture is really great for relaxation. It has some anxiolytic effects and antidepressant effects, but there are cases where acupuncture is not enough. So acupuncture, like you said, it's not an alternative treatment, can be a complementary treatment as well. And I want to see it more like that, a complementary treatment. So sometimes it's important that patients are on the right medications if they need antidepressant, whatever they need to feel better. And acupuncture can complement the effects of those medications and help them feel better. And there are so many studies showing that when patients that are on antidepressants, when they get acupuncture, it really improves the effect of the antidepressants, and they do feel much better. About resilience, I don't know. I think I have to think about that a little bit more.
It's something that I don't know, just maybe more recently I've recognized that that's something we want to address in our practice. And there's a doctor who I meet, Sood, who is a internal medicine doctor. He was at Mayo Clinic Rochester. Now he's on his own, but he has a resilience practice. Like, he works on helping people with resilience. And the more I go along in life and seeing patients with the things they struggle, I'm realizing that this is something that's really important. Like, I think building that resilience is critical to early life success. Like, because we all know nobody goes through and it's all, moonbeams and, cherry pies. Like, we have to be able to take those hits and bounce back. But as people get older, I'm recognizing their resilience reserve often gets more and more depleted, and that is a sign that I'm really concerned about. Well, Dr. Karla, this has been really a great experience for me, and I know our audience is really going to resonate with this message as well. For people out there that want to learn more about you, your practice, how do they get in touch with you?
So I think the best way to do it is in my website, www.alivia, A-L-I-V-A, acupuncture, A-Z as in Arizona.com. I have an Instagram account and a Facebook account as well. And they can call me, of course, schedule a free consultation. I'll be happy to see them and talk more about how acupuncture can help them.
Beautiful. All right. Thank you so much for joining us.
Thank you so much for having me. It's been a pleasure.
All content created by me and HealthspanMD is for general informational purposes only and is not the practice of medicine. No doctor-patient relationship is formed. The use of this information is at the user's own risk and is not a substitute for professional medical advice, diagnosis, or treatment. Hi, I'm Dr. Hurst. We created HealthspanMD for people who are dissatisfied with healthcare. Common complaints about healthcare include difficult access, poor communication, rushed appointments, disease-focused or sick care with little interest in helping people get or stay healthy, and little to offer beyond a prescription or a procedure for optimizing health. This type of healthcare is unacceptable. but most aren't aware that they don't have to accept low-quality health care. HealthspanMD provides exceptional medical care. That means appointments when you need them, time to talk to your doctor, get your questions answered, understand your problems, and get a clear plan to achieving your health goals. But it also means a comprehensive, proactive approach to your health that goes beyond prescriptions and procedures. As a HealthspanMD patient, you will get our expert, physician-led team of doctors, health coaches, dietitians, exercise specialists, mental health, and other health professionals to help you take advantage of your best opportunities to prevent, treat, and even reverse disease. And you may be eligible to have our care model reimbursed by Medicare and some commercial insurance. If you're no longer willing to settle for low-quality health care, schedule an appointment at HealthspanMD to experience health care as it should be.